Hi everyone, welcome back to Pharmacology classes by MSR. In this video, I am going to explain about passive surveillance. What is surveillance? So, surveillance is nothing but close observation. Surveillance, sir indicates from above. Veillance means to watch. So, always to keep a watch on something is nothing but surveillance. Whereas in pharmacovigilance, surveillance is nothing but always we are checking or keeping a watch on the drugs or the vaccines to analyze, to collect the information, and whatever information is there, whatever in adverse effects we are detected, that will be reported to the regulatory authorities for the decision making. So the definition is surveillance is a systematic process of collection, transmission, analysis and feedback of public health data for decision making. So as I told, surveillance is a continuous watchfulness over the distribution and trends of the incidence of diseases through a systematic collection of consolidation and evaluation of morbidity and mortality reports and other relevant data. So whatever information is there regarding the drugs or vaccines, always we are having a close observation on them, and whatever information we are collected, we are submitting them to the regulatory authorities. Surveillance is basically of two types, passive surveillance and active surveillance. So, passive surveillance means whatever data we are collecting it on a regular basis from the physicians, clinics, laboratories, hospitals. Here the persons play a major role. Whoever is coming to the physicians or clinics, the physician will collect the information and they will be submitting to the regulatory authorities. Whereas active surveillance, it is a collection of periodic reports through the phone calls or by visiting the hospitals, laboratories, or for the health departments, etc. So the active surveillance identifies the cases through the screening of the hospital admission records or the emergency department logs, medical wards, ICUs, outpatient facilities, including the nursing homes, radiology centers, physician offices, etc. So, here screening plays a major role in the active surveillance, and the appropriate screening with standardized procedures is necessary to minimize the missing cases. So, passive surveillance is a regular reporting about the diseases and the information or the data regarding that particular disease by all the institutions where the patients are visiting. So, here the healthcare workers, the physicians, they play a major role. Whoever is working in the towns, schools, hospitals, laboratories, they should report about these diseases. And this process is called as passive surveillance, and in this the state and the local health departments are responsible for collecting the information from the physicians, and this passive surveillance have certain limitations. We will see them. So in passive surveillance, the physicians usually they will not report frequently about the cases because they may not be aware that this is a reportable disease. They may not be aware of that particular disease that it should be reported. And because of that, the information that need to be submitted may be delayed. So the laboratory results may be delayed. So the timeliness of the report may be affected. And the criteria are established for this reporting diseases. What are the risk factors or the health related events? Already their criteria are established, and the healthcare practitioner, they should be notified that what reports should be submitted, on what reports you have to pay the attention, what should be reported. Already their criteria are mentioned. So this passive surveillance is the most common type of surveillance. For example, a physician examines a patient and he identifies that or diagnoses that that person is being affected with the measles. Then what happens? He will initiate a case and report about this case to the local health department. Now what the healthcare department will be doing? They will rely on this particular physician to give the next reports about the measles. So here this surveillance relies on the physician who is reporting about the particular disease. This process of surveillance is simple to conduct because once a procedure is being established, All the criteria are already predetermined, so it is an easy method, but a person who is reporting plays a major role, and it may be not complete to have the surveillance dependence on this particular method. Passive surveillance may be done as spontaneous reports. Nothing but when the physician identifies any adverse event or the diseases from the patient whom he is treating, then he will spontaneously report them to the authorities. And the reporting system will be done according to the predetermined criteria, rules, and policies. Coming to the advantages of passive surveillance, it covers large population at very low cost. It includes the testing of all the company drugs, whatever being used by the patients. It can detect the rare events and the risk factors, and it creates a hypothesis which can be tested with more active methods. Limitations of passive surveillance method. So, due to the lack of motivation, lack of knowledge about the procedures to follow and the procedures to submit the reports, the physicians may be delaying in this particular procedure. So, that is the limitation of passive surveillance. And whatever the reports that may be received after the event occurred, after a long period of time, a physician may be submitting those reports. So, the follow up discussions, availability of the information about that particular disease or the ADRs may be limited. There may be bias in the selection of cases that are being reported, and whatever data reported may be incomplete, and it will not be well validated. The data submitted are often difficult to interpret. Spontaneous reporting. So, spontaneous reporting is nothing but a voluntary communication between the healthcare professionals or the consumers, whoever want to report about any ADR on a particular rare disease, to the regulatory authorities or to any organization like WHO or the regional centers or the poison control centers, which will describe this particular adverse reaction in the patient when they are being administered with the medicinal products which are not derived from the study, or they which don't have any organized data about this particular thing. So, these spontaneous reports play a major role for the identification of the safety signals once a drug is being marketed, and it will also alert the company about these rare events which are being not detected in the clinical trials before it is marketed into the before it is marketed. So, the spontaneous reports provides the information about the risk groups, about the risk factors, and the clinical features of the known serious ADR. So, the caution should be taken for evaluating the spontaneous reports, especially when comparing the drugs. And the data which is being obtained from these spontaneous reports will be often incomplete, and the rate at which the cases are reported will be independent upon various factors like the time when the drug is being released into the market, what weight are, many factors are regulated to the regulatory activities, what is the media attention over this. These are the various factors which may affect the reporting system. Systematic methods for evaluation of spontaneous reporting. So, the consumers or the healthcare professionals who identifies the ADR or any rare signal or rare disease, they will report it to the regulatory authorities or to the WHO or the poison control center. So, whatever spontaneous reports they are receiving, they will evaluate it by the systematic methods, which may be the Bayesian's method or any other technique for the signal detection. Most of the methods are still under the development. One of those techniques is data mining. So, this data mining is a technique which will convert the raw information whatever we received from the healthcare professionals or consumers into some useful information. So, this data mining helps us to examine the drug-drug interactions, but this data mining should always be used with some other method in the conjunction, nothing but with some other method. It only this technique can't be analyzing for the single case reports, and it will facilitate or help for the evaluation of the spontaneous reports by the statistical methods, so that we can detect the potential signals for the future evaluation. And this tool will not quantify the magnitude of risk and the caution that should be exercised when we are comparing the drugs. The data mining techniques should be considered to have or to detect the signals, since there are some implications for the sensitivity specificity of this particular method. Data mining will not report the factors which are affecting the spontaneous adverse event reporting system. And the results of this data mining should be interpreted with the knowledge of the weakness of reporting system. And when they have large differences between the area reporting among different drugs, so there may be bias, there may be some lacking of information, lack of knowledge of that particular reporter. So all these factors should be considered, and all the signals should be evaluated to identify what is false and what is a positive effect, what is a positive result and what is a false report should be identified. If the drug or a particular disease doesn't show any signals or areas, it doesn't mean that the problem doesn't exist. There may be areas but there may not be reported. And case series of the case reports play a major role to provide the evidence between the drug and the adverse event. They play a major role to identify that yes, we may hypothesize, we may think that yes, so and so ADR may be developed with so and so drug, but we can't verify it. The association, yes, what is the link, how this drug is causing that particular ADR, that mechanism can't be identified by this process. So, there are various adverse events that are associated with the drug therapy, like anaphylaxis, aplastic anemia, epidermal necrosis, or Stephen Jones syndrome, which is an severe skin reaction. So, when these events are being reported, the sponsor should more concentrate on the reports, and to they should have the detailed follow up of this particular reports to analyze the ADRs which are associated with those drugs.